Shannon is now 12 years old, but when she was born, she's our second child, we noticed that she had a big ridge in her forehead. Your skull is in many different plates, so you can go through the birth canal. And Shannon's particular metopic suture was closed, and I found out very quickly would to have surgery. So you can imagine it's extremely scary, as a parent to hear this news, and you just have your newborn.
It's definitely something interesting, and I can't believe that it happened to me. I always never thought that was possible for really anybody to have something happen to them that soon in life.
As her head was growing, because this part was fused, it was growing further and further into a deformity. I was literally watching my child's head become more deformed. And because the brain will push in areas where it can grow. It couldn't grow forward, so it became something called trigonocephaly, and her head was literally a triangle shape. And actually, it was my neurosurgeon that highly recommended Dr. Greenberg. So we met with Dr. Greenberg, and I have to tell you, a lot of it is your gut, like what you feel is right. And after seeing all those doctors, I knew it was right. I really knew it was right. So my husband too. So at that point we booked it, and they were wonderful because they believe in around 4 to 6 months. Shannon was actually 6.5 months at the time of surgery. I mean, as little as she was, she knows that Dr. Greenberg was the one that she'll say, he's the one that fixed my head, right? And that's the truth. So we're very grateful to him. He gave her the chance. Dr. Greenberg gave her the chance. He removed what shouldn't be there, and then her head did the rest, grew into its own. So we're just really happy. Other parents don't know that their child has craniosynostosis. They're faced with the decision of who to see. And let me tell you, I have referred many people to Dr. Greenberg, and he has actually done consults just, as a courtesy for these parents who are scared and confused.
I love art. Art is definitely one of my favorite things. A lot of people ask me what kind of art I do, and I can only answer them with everything. I really love painting, and I do all kinds of stuff like that. I love drawing.
Lots of patients, craniosynostosis patients, need follow-up surgeries, and with Shannon being so super severe, it's truly amazing that we have not needed to face that. We have connected with other craniosynostosis families, and I would say all of them have needed follow-up surgeries except for Shannon.